Joining me today are Dr. Rick Anderson, who's the Senior Vice President and Chief Medical Officer at Tucson Medical Center, Dr. Gordon Cara, who's the Chief Medical Officer at Banner University Medical Center, Tucson, and Dr. Bobby Robbins, President of the University of Arizona. I'm also joined by Dr. Cara, who's been my director at the Arizona Department of Health Services and the guiding light through this crisis to date for the state of Arizona. As the situation of the virus continues to evolve, guidance from the CDC at the national level is also evolving. This morning, the Arizona Department of Health Services updated its guidance for bars, restaurants, dining establishments, childcare, and more. And we have already updated our guidance based on the CDC recommendation that large events and mass gatherings be canceled. Many of these events already have been canceled. The private sector and community organizations continue to be responsible partners in this effort. I want you to know our decision-making framework. We're not guessing. We're being guided by data, facts, and science in consultation with subject matter experts. COVID-19 is a challenge unlike any we've faced as a state or a nation, and we need everyone to pitch in. Here's how you can help. We need people to donate blood. Levels are dangerously low. Our food banks also need your help. I encourage Arizonans to contact the Red Cross and local food banks and do what they can on these fronts. I want to give some praise out for our hospitals and our healthcare workers. Our state health professionals, led by Dr. Cara, have been working around the clock to address this disease and provide additional testing. Today in Tucson and Phoenix, I met with chief medical officers and other leaders from Arizona's hospitals. Our doctors, nurses, and other medical professionals serve on the front lines, and Arizona is grateful for their efforts and hard work. Yesterday, I met with representatives from private sector labs, expanding testing capacity throughout Arizona, including here in Tucson. Both Banner Health and Sonora Quest opened their first patient-friendly testing site to increase the speed and viability of testing, with more on the way. More partners like LabCorp, TGen, Mayo Clinic are also conducting testing for patients in Arizona. And today, I especially want to thank those who are holding our community and our state together. Community leaders, nonprofits, the law enforcement officials, faith-based communities, doctors, nurses, and our grocery store workers who have been working around the clock to meet demand. And finally, I want to reassure Arizonans, we're going to get through this, and we're going to get through this together. There's a lot of work to do, and as you can see here today, we're dedicated to getting it done together in partnership. It's going to take all of us. And now I'd like to turn it over to Dr. Christ for an update on the very latest on COVID-19. Dr. Christ?
Thank you, Governor Ducey, for your leadership and making the health and safety of our communities your top priority. My team has been working nonstop in response to COVID-19 to ensure we keep our communities and families safe. We're constantly monitoring local, national, and global activities so that we can make data-driven decisions that protect our communities while having as minimal of an impact on Arizonans' daily lives as possible. I want to provide the latest information about the spread of COVID-19. To date, we have 20 cases in Arizona. There are 9 cases in Maricopa County, 5 in Pinal, 1 in Graham County, 1 in Navajo, and 4 cases here in Pima County. Arizona has community spread of COVID-19, and we are expecting more cases. Because of this, there is a heightened level of risk of COVID-19. Our goal is to mitigate the spread of this disease and lessen the impact on people who are at highest risk for serious complications. People at highest risk include our older adults and people with serious medical conditions such as heart disease, diabetes, or lung disease. My team has been working tirelessly to ensure Arizona complies with the new guidance provided by federal officials this week. And our federal officials are now advising if someone in your family has tested positive for COVID-19 to keep the entire household at home and contact your medical provider. We strongly recommend that dining establishments in areas of known community spread discourage dine-in traffic and instead provide curbside pickup or drive-through service. Do not visit nursing homes or retirement or long-term care facilities unless you are required to provide critical assistance. Employers should develop protocols to work from home when possible. For those workers in our healthcare industry and pharmaceutical and food supply, your continued service is crucial. We need this community to maintain their normal work schedule and follow CDC guidance to protect your health while you are at work. Everyone should avoid social gatherings in groups of more than 10 people, and we recommend avoiding discretionary travel, shopping trips, and social visits. As Governor Ducey and Arizona Superintendent of Public Instruction Kathy Hoffman announced on March 15th, Arizona schools are currently closed statewide through Friday, March 27th. We encourage people, particularly high-risk individuals, to have supplies on hand, such as extra prescription medications or over-the-counter medications that they may need. Take everyday precautions, such as avoiding people who are sick, washing your hands often, and cleaning and disinfecting high-touch areas in your house like doorknobs, light switches, toilets, faucets, and phones. Stay away from crowds if possible, and have a plan if you get sick to call your healthcare provider and identify who else can help care for you if your caregiver becomes ill. There are a lot of questions about getting tested for COVID-19, and I want to provide you with the latest information about testing in Arizona. There are now several commercial laboratories that can test for COVID-19. These labs include LabCorp, Quest, Arup, Mayo Clinic, and TGen. And we want to thank each of these labs for working to get private tested implementing so we can test more people in Arizona. People should work with their healthcare provider if they are symptomatic, and all tests must be ordered by a healthcare provider at this time. Please call ahead before going to see your healthcare provider so that they can give you instructions on how to keep other patients safe. We know that Banner and other healthcare and laboratory partners are in the process of implementing screening locations. In order to support this activity, I have issued a standing order that will allow symptomatic Arizonans to receive screening at these sites. More information on these sites will be available soon, and we will get this information to the public when it is available. The Arizona State Public Health Laboratory will also continue to test samples that are sent from our public county health partners. As of today, the Arizona State Public Health Lab has tested 221 individuals. The lab has ruled out 142 people, and there are 66 samples pending. Of the 20 cases we have in Arizona, 12 have been confirmed by the state lab, and 6 have been confirmed by private labs. To stop the spread of COVID-19 and protect our most vulnerable community members, we ask everyone to routinely implement infection prevention practices. The best ways to prevent the spread of respiratory viruses are to do the following, and I know everyone has heard me say this over and over again, but we can't emphasize how important this is. Wash your hands with soap and water often, and you want to do that for at least 20 seconds. If soap and water are not available, use an alcohol-based hand sanitizer. Avoid touching your eyes, nose, mouth with unwashed hands. Avoid close contact with people who are sick. Cover your cough and sneeze with a tissue and then immediately throw that tissue in the trash. Clean and disinfect frequently touched objects and surfaces. And if you need to see a healthcare provider, consider using telemedicine if that is an option. We urge everyone to find reputable sources for information about COVID-19 and don't spread inaccurate information. ADHS has a website dedicated to COVID-19 that is updated daily. You can find the most up-to-date information about the disease at azhealth.gov. The CDC also provides current updates about the latest information, and they update their website daily. The Arizona Poison Control is partnering with Public Health to offer a COVID-19 hotline for the public and medical providers. This hotline can be contacted at 1-844-542-8201. We will continue to provide the public with the most up-to-date information and advice on how to keep yourself and your loved ones safe. I'm going to turn it over now to Dr. Anderson from Tucson Medical Center.
Thanks, Dr. Christ. I have very brief comments. On behalf of Tucson Medical Center, we want to thank the governor and Dr. Christ and the whole team for coming down here and briefing us on the state's efforts on COVID-19. For TMC, really what I'd like to just ask the public is just to be aware that we're putting what we feel is necessary measures to prevent increased visitors into our hospital. It's really to protect our staff and patients. Sometimes it seems a bit onerous, but we're doing it really to protect our patients and staff. So be aware that we are not watching, but making sure that people that enter the building are screened and don't have signs of COVID-19. So, and again, thanks, Governor. Thanks, Dr. Chris.
Well, on behalf of Banner Health and the leadership generally of the Southern Arizona healthcare community, I wanted to echo thanks and gratitude to the governor and his team for spending a great part of the afternoon with us today. Today we had an open and very collaborative discussion about the situation on the ground, and we also had a very collaborative discussion about the resources that the healthcare community needs in order to continue to keep our patients and our communities safe. The safety of our patients and our communities is our top priority, not only at Banner Health, but at all of the healthcare provider organizations that are operating across the state. And we are very grateful to the governor and his team to taking the time to listen with us, to partner with us, and to advocate on behalf of the healthcare sector so that we can serve our vital mission to the community. Thank you, Governor.
Thank you, Doctor. Thank you, Dr. Christ. We're going to continue to work on this 24/7. We've cleared the deck. This is my top priority. It's my team's top priority. It's Dr. Cara Christ's top priority. We're going to be calm and steady with a sense of urgency on our decisions, and we will be transparent. When we know something, you'll know something. We're happy to take some questions.
Start over here. All right, I have two. The first one is, we're told it's taking 10 to 14 days to get test results. How many patients are sitting in the local hospital waiting for this result? And also a follow-up, you said there's 4 in Pima County that you're hearing, there's 5 cases at TMC and 2 at St. Joe's. Do you know the discrepancy in that?
So yes, I can answer hopefully most of the questions. So it's going to depend if it's coming through a commercial lab or a public lab, or our public health laboratory. So we get all of the information that is with the public health lab, because those investigations are started when we agree to even accept the sample. For those that are going through a commercial lab, they can take longer. We do know that there are national shortages of the test reagents, which could delay the time that a lab is returning results. If they are a commercial lab that are going through, we won't find out about those cases until they're reported up through public health to the state health department. So we work on a daily basis to try and gather that information, but we don't have the total number of people who are actually being tested through our commercial labs.
And then on that follow-up, we're hearing 5 cases at TMC and 2 at St. Joe's. You said
So those would be the 4 confirmed cases that have made it all the way through and have been reported to the state health lab. There is a delay if the commercial lab goes to the provider, and it hasn't been reported to public health yet.
And is there anything being done to make sure the test results are getting out faster?
To get them quicker reported, or to get them, so we do work with our local health departments who work with the providers. It is a requirement by Arizona Administrative Code that they do report to the health department, and so we work on getting those updated.
What's the capacity of the state with our commercial partners? How many people can we test a day?
So if we had our commercial partners, it's a couple thousand per day, and that continuously increases. We know the capacity of Sonora Quest right now is about 1,000 patients per day. Our capacity would be about 450 at the Arizona State Lab. LabCorp, we're still working with them to determine what their overall capacity is, but as they bring on additional capacity, we know that Sonora Quest is trying to get to 4,000 per day. So we're working with our partners on increasing that capacity.
So if there's 1,500-ish tests available, or 1,500-ish people being tested a day, and why or why not?
So for the public health lab, we're focusing primarily on those high-risk individuals. The commercial labs, I don't know if they're processing that many a day because negative results are not reportable to the department.
Is there any talk about expanding to include people other than those high-risk individuals? When do we start seeing that? I mean, there's places like New Mexico and Colorado have started these drive-in test sites. When are we looking at doing something like that?
So with the Public Health State Lab, we are looking at expanding that capacity. We currently right now have enough to run 1,900 samples. So we continue to assess what our capability is along with our available reagents and test kits. The drive-through has actually already started. So Banner did a soft run up in Phoenix yesterday to identify what they would need to do in order to improve and expand to additional sites. TGen partnered with one of the healthcare partners up in Flagstaff and also offered a drive-through. So we are continuing to expand those opportunities and work with partners. The Department of Health Services held a call today with our hospitals and healthcare partners also to help them walk through the process of standing up those testing sites. One of the barriers, though, is the national shortage of the nasal swabs that's used to collect the samples.
I guess just like in Tucson, you have an idea of like something like that here in the county?
I would have to check with Banner on that. I know that they do have plans to roll something out here in the Tucson area.
How well fixed is the state for critical treatment supplies like ventilators, associated parts like that, vacant hospital beds, and so on? And if you are short of them, where are you going to get them? The president said that the state should try on their own as opposed to the federal resources.
Right, so we are assessing where our hospitals are right now with ICU bed and ventilator capacity. We are also exploring the possibility of opening up additional beds in facilities that currently don't have any patients in that. So we are looking at all of those. With the ventilators, we're trying to get a really good idea of how many ventilators there are. Worst case scenario, I don't know that anybody will have enough ventilators, but we're looking to see how we can increase that capacity in Arizona.
When you talk about unused space, are these like vacant hospital wings? Please describe.
Yes, so up in Phoenix are the two that I'm most familiar with, but we have two hospitals that had shut down and have not been in operation. We're looking at how do we bring those back up so that we have additional capacity if we need to use them. But we will also explore with hospitals if they have wings or units that aren't currently being used, explore with them to get those beds available for additional overflow.
What are some of the challenges of bringing up a dormant building and getting it sanitized and operational?
So luckily up in Phoenix, those hospitals have not been closed for very long, so they'll require very little work to bring up. I mean, it's really going to be, can we get the appropriate staffing in order to staff an additional hospital if that's what was needed. Depending on other facilities, if it's an operating hospital and they just want to expand into a wing that is not currently being used, that's a relatively easy, it's just licensing going in and approving that. Within our hospitals, we are hearing that our hospitals are impacted by healthcare shortage. I know that the one that we run, we are doing overtime and trying to get additional staff in. So it is something that we're monitoring, which was one of the critical decisions as we weighed the school closures, because we really need to keep that healthcare worker and that critical infrastructure employees at work so that those types of services can go on.
state lab had a false positive today because of contamination, so that is no longer a positive case. What does it say if the CDC retested your positive case, says it's really negative, and they're no longer verifying tests for the state lab? What does it say about your state lab and running tests?
So there's always the possibility for some type of adverse or wrong test result. And so that was a result of a contamination in the well. We have changed our processes accordingly to ensure that that doesn't happen again based on feedback from the CDC. We are treating every positive as if it were truly a positive. So that case was completely worked up, was completely investigated, and so we responded appropriately as if it was a positive, so there is no risk to the public health on that.
Okay, and Governor, you're gently suggesting not going to bars. Meanwhile, you have places like Phoenix, Tucson, some of the largest cities, taking more proactive steps. Why the relaxed direction?
There's no relaxed direction. The state is in a public health emergency declared from the governor's office, along with guidance and executive orders. Phoenix and Tucson are our largest cities. We also have rural Arizona. The guidance that I give is statewide, and the powers that we have, we will use every tool in the toolbox. I'm not guessing on any of these decisions. I'm following the medical guidance of the Centers for Disease Control and Prevention, the National Institute of Health, in consultation with the Department of Health Services. So the directives are out there. I'm respecting local leaders' decisions that are different than other municipalities around the state, and we're over-communicating so that all Arizonans, all business owners can be aware of what the expectation is.
Wouldn't it be easier for everyone in the state to just be under the same direction?
I want to make the best possible decision for all Arizonans, given the facts that we have. Now, I'm fortunate because I have access to people that are experts in this. My director of the Department of Health Services is an infectious disease epidemiologist. She has a degree in molecular virology. She guided the state through H1N1, Ebola, and the measles outbreak. I'm asking for that guidance on what is the prudent decision. We want to make certain that we've got a sense of urgency and we stay a step ahead of this. At the same time, we realize that the conditions on the ground are changing hourly. So we can escalate and make decisions in the future that have not yet been made. We just want to be responsible and prudent. I'm not in competition with any other governor or place in the nation. I want to make the best decisions to protect public health in the state of Arizona, and I'm confident to date we've done that.
Come over here. Regarding the blood shortage, locally there have been more than 40 blood drives canceled by the American Red Cross. Are we looking at opening more options for people to get blood?
So we are working with our blood system partners to encourage, to give guidance on how to safely collect blood while dealing with this response. And so we've been working with them, so we should start to see increased access to blood donation.
We'll go to Lorraine back here and then next to her.
Do you have any recommendations for grocery store shortages that we're seeing? Any message to the public about the need to tamp down some of the efforts there?
Well, I would say first and foremost, I've gone out of my way to make sure that the messaging that we're communicating are the facts in a timely way. We've wanted to avoid being alarmist and certainly want to tamp down some of the very real fear that is out there. So I would ask Arizonans to buy what they need. I have a lot of confidence in our grocery stores and our manufacturers to restock the shelves. There has been a run on a number of different issues over different times, depending on what outlet they've been listening to. The only thing that I've heard Dr. Christ comment on that someone should be stocking up on are prescription medications for those that are chronically ill. So I think that we can really be partners here. We're going to communicate this way out of the governor's office and all of our outlets to the media, but to make certain that we aren't getting these runs on water. Our water supply is in very good condition, or toilet paper, hand sanitizer, et cetera. And I don't know if you have anything to add, Doctor.
Are you having conversations with the Department of Homeland Security, given now that there's a confirmed case in the state of Sonora, about just the validity of what's taking place at Fort Smith?
We've had very good discussions with all of our federal partners. Vice President Pence has hosted a video conference call with top leaders in the federal government, from Alex Azar at Health and Human Services, Secretary of Agriculture Sonny Perdue was on the last one, the Acting Director of Homeland Security, along with NIH and CDC. So we're sharing information. I will say the communication between us, the federal government, and really all 50 governors and those that lead our territories around North America has been very good, and we're trying to communicate the facts and what's happening state by state, and also what best practices are in terms of how people are making decisions and what metrics they're following as they escalate the powers that are granted to us as governors.
Again, with my earlier question in regards to directives from Mayor Gallego and, of course, Mayor Romero in regards to limiting exposure for the community. From your discussions with your experts here, what would it take to maybe change that mindset? So kind of had different mindsets from our local leaders.
It would be guidance from the Centers for Disease Control. We've been hand in glove with the Centers for Disease Control in terms of the guidance and directives and decisions that we've made. I, as governor, of course, can exercise these powers, but I'm going to work with the subject matter experts in making those decisions. I'm not guessing.
Did you have a question? Then we'll wrap it up back over here.
Yeah. So I know that we're always kind of concerned about patient privacy, but in counties around the state have been doing this differently. But in Henry County specifically, we haven't received any information as to the age of these patients, their genders, the hospitals that they're located at, whether they're recovering or not. So I'm just wondering, is that information that the state is tracking, and will that information be available to the public?
So we make every decision that we decide to release, we weigh on that individual's privacy. I mean, think if that was you, how much would you want out about your personal life out in the public? We weigh their personal privacy with the risk to the public. And so we give as much information as we can so that the public can make informed decisions on their own behalf. So with something like measles, where you could walk into a room and breathe the air and become infected if you are unvaccinated, that we give a lot more information about where someone is, how long they were there, versus something that's spread really by close contact and droplet spread. So we do weigh that, but we take an individual's privacy extremely serious.
Can I do a follow-up question? I'm sorry. That completely makes sense to me. But as far as like tracking the information on a state level, just because obviously you want to know that people over the age of 65 could be getting this more often, or people who are immunocompromised. So I'm wondering if you're tracking that information in that space.
Yes, so the public health system is tracking that information so that we can identify if it's getting into vulnerable populations or if it looks like it's in specific communities. That helps guide our recommendations as we move forward.
Megan, and we'll wrap it up here.
Quick question. So we've been hearing from some of our healthcare workers who are on those front lines, that they don't have enough masks, that either their agencies have run out of masks, and they're telling their employers, sorry, either reuse a mask, don't use a mask,
So there is currently a national shortage on the personal protective equipment, the PPE. We are working with our local health departments as well as our healthcare system to try and allocate the limited resources that we have. We are expecting a shipment from the Strategic National Stockpile, which will contain masks, gowns, and the personal protective equipment this week, and then that will be distributed to our counties. The hope is, as that Strategic National Stockpile gets out, they are trying to increase production nationally within the United States manufacturers so that we can get more masks, gowns, and gloves online.
Just a quick follow-up, why don't we have a stock of that already in case something like this does happen?
So we did have a stock of that here within the state. We do have our local health departments which can purchase those types of supplies. We had a cache of those types of supplies at the state, which we've already pushed out and has already been used.
Okay, two questions for Governor Ducey. One, do you have any plans for monetary relief for those who are directly impacted by, businesses closing, restaurants closing? And two, do you have any plan in place for daycares closing, people on the front lines who need to go to work and have their child watched?
So my first concern every day throughout this crisis has been around public health first, and those are all the decisions that we've been making. Now, I also understand the impact that COVID-19 is having to our economy. When we talked about the school shutdowns, and that wasn't to reduce the spread of COVID-19, that was for administrative reasons. We're going to do everything we can to make certain that there's no disruption in pay. And to date, the state has not shut down anything except our K-12 education system. And that's been for 2 weeks.
Absolutely. So some of the questions that some of the data that we will get just an electronic upload of all of their data. We don't get it from everybody. It isn't required. For those laboratories that don't report electronically, that would be a significant burden on them, and we don't collect negative data for a lot of our other diseases. And with something like this, where it's not just a one-time exposure and then you can get tested and you're cleared, you could get tested, be negative, and then be exposed as you're walking out of the laboratory. So having that whole community look at what is negative just gives you what that was at that individual point of time, but doesn't give you real-time knowledge of what's going on in the community.